Stewart, and I work here at Memorial ER for the last 20 years. I'm a nurse. I teach CPR, ACLS, PALS, and TNCC. I'm going to talk to you about American Heart Association classes. I'd like to persuade you to become a CPR instructor and take your CPR classes seriously and do your renewals. So as many as 400,000 people in the United States suffer a cardiac arrest, will this year suffer a cardiac arrest. The majority of these individuals will die before even reaching the hospital. It's a known fact that more people need to be trained in CPR, cardiopulmonary resuscitation. The amount of survivors could double or triple. Statistics show that the amount of Americans, populations, 70%, may not even respond during a cardiac arrest emergency because they're undereducated, they're nervous. They don't want to put their hands on the patient. So that's why we started bystanders hands-on CPR. We teach them just to do compressions only, and that will get a small percentage of help back with those patients. So they don't even want to learn how to apply these life-saving techniques of cardiopulmonary resuscitation. These sad statistics, and the American Heart Association's mission is to improve the numbers, getting people CPR certified. Heart Association classes is dedicated to reducing the amount of deaths caused by cardiovascular disease and stroke. During these CPR classes, they teach you a lot about heart attack and what to do during a stroke and what action needs to be taken. One of these ways, though, is training people how to use CPR to save lives of someone under cardiac arrest. Okay, these classes are for everyone. Okay, not just medical professionals. Okay, so become a CPR instructor. So let's talk about just becoming a CPR and first aid instructor. With the help of a dynamic instructor trainees, we'll develop adult education skills that will draw your client and your student into engaging training sessions that will enhance their life. They receive high quality training programs through skills, comprehension, and confidence. So you practice to become more dynamic throughout this provoking class. So it's a one-day training program, all mostly hands-on, a little video, and a little instruction and a test at the end. So you must be CPR certified to do your instructors already. Okay? So why take American Heart Association classes? Knowledge of CPR is going to, number one, give you the ability to save a life, or teach somebody the ability to save a life. Your workplace or school may ask you to be CPR certified. You may work in a field that requires CPR. Just about pretty much any job employment that's in a big facility needs somebody that's certified in CPR, or multiple people that's certified. Some of the courses that you could teach. CPR courses for healthcare providers, so that's your medical personnel, designed for healthcare professionals that need a CPR and respond to emergency calls. Okay, it's a BLS certification that includes an exam and about 4.5 hours of practical with exam. Okay, advanced cardiac life support. This course is mostly for nurses working in the ER, ICUs, and any telemetry areas. Okay, CPR for healthcare providers, again, that's just for non-healthcare providers, could be for anyone wanting to take a CPR class. Okay, they're very train you as a proficient provider in CPR. Sometimes workplace or school, a lifeguard may need this class. Heart Saver First Aid CPR, again, most of the time babysitters need this class. So you could teach those kind of classes too, and give babysitters some really good information, especially when to call 911 about all of those childhood injuries and illnesses. Just your hands-on, your family and friends also are just hands-on. They actually just have a video that they can send to your house for family and friends that just shows you how to do compressions and when to call 911. They talk about strokes and heart attacks and general emergencies. Okay, just some references for you. Is there any questions? I hope I persuaded you a little bit in becoming a CPR instructor. Thank you. Yay!